Okay, so I have Jerry Batch's chart here. His birthday is 06/16/19XX. I can see he does have an allergy to povidone iodine, and there is an order from the physician to discontinue his indwelling urinary catheter. So we're gonna grab the supplies and head into his room. Okay, so I have my gradual alcohol pads, biohazard pads, some chucks, this sterile unopened syringe, and my pericare stuff. So you can go ahead and go in. Knock knock.
Hello.
Hi there, how are you today?
Good.
Good. My name is Emma. I'm going to be your student nurse today. So I'm going to provide a little bit of privacy. Can I have you please verify your name and date of birth?
Yeah, it's Jerry Batch XXXXXXXXX.
Wonderful. And did you have any allergies that we needed to be aware of, Jerry?
Yes, I'm allergic to iodine.
Okay, thank you for letting me know. That does match your chart. And are you allergic to any latex or adhesives?
Just iodine.
Just iodine. All right. Well, we'll make sure that there's no iodine in use today. We are going to be discontinuing or removing your catheter. So pretty exciting stuff. I'm just gonna have to do a quick urinary assessment on you. We'll empty the bag, measure your urine, and yeah, it should be super, super quick and easy. Did you have any questions for me?
No, I don't think so.
All right, I am just gonna go ahead and lay you down. It does make the removal a little bit easier. All right, do my hygiene here. Make sure your bed is locked. Get some gloves on. You said you didn't have a latex allergy, right?
Nope, I don't.
Good deal.
Just please don't use iodine on me.
I promise I won't use any iodine. Are you experiencing any pain associated with your catheter?
Nope, I'm just excited to have it out.
I bet you are. All right. Have you noticed any blood or sediment in your urine recently?
Nope.
All right, good deal. Do you mind if I pull your blankets down?
That's fine.
Thank you so much. All right. So I'm gonna pull this up here. I am looking, I can see that skin color is appropriate and hair distribution is still good. There are no obvious signs of distension. I don't see any obvious signs of infection, lesions, or any skin breakdown near the tip of the penis. So I'm just gonna go ahead and palpate your abdomen. Is that okay?
That's fine.
All right. So once again, I'm just feeling for distension right here. I don't feel any right now. And then I'm just going to palpate down the penis, looking for any lumps or bumps. Do you feel any pain as I do this?
No, I don't.
All right, good deal. So, just gonna do this. Okay, and we are good to go. I'm gonna go ahead and get some new gloves on. And I'm just gonna drain the urine that is currently in your tube. And then I have to measure your urine that's in the bag. And we'll be pretty much all done. I'm gonna place a little Chuck's pad underneath you right now. Alrighty. Just gonna place this right underneath you to collect any trippage or anything like that. All right, I am going to go ahead and remove your adhesive here. I'll try to be nice and careful. Is this hurting you at all?
Nope, it doesn't hurt.
And are you having any reactions or any itching, inflammation, pain, or anything where the adhesive was?
Nope.
Okay, perfect. Glad to hear it. So I'm just going to grasp this here and drain what urine I can down the bag. Normally it wouldn't continue filling up with urine, but because it's a mannequin, it does that sometimes. I'm just gonna keep you covered up here and grab all of my necessary supplies. Okay, place my Chuck's pad down. Make sure look at the urine. It is yellow, it is clear, there's no signs of blood, sediment, or cloudiness in it. Open this up. I'm gonna go ahead and cleanse the tip here. As I drain it, I'm going to make sure the urine isn't splashing or this part isn't touching any part of the gradule. Okay. And then before I put it back, I'm going to lock that and sanitize it one more time just to be safe. I'm going to sanitize this part and sanitize the inside here. Take this and place it here. All right, looks like we're at about 200 cc's. I'm gonna let those bubbles settle and we'll remeasure again. All right, this checks pad would go right into dirty linen. And we're gonna change my gloves once more. We'll go ahead and get that pericare going for you. Or I'm sorry, we'll get your catheter taken out and then we'll do your pericare. Okay. So I'm gonna use my biohazard bag here. I'm just going to attach it to the bedside table, just momentarily. And that's where the catheter is going to go. So I'm going to lift you up here, lift your gown up, and then I'm going to open this sterile syringe away from my body. I'm going to grab the port and insert it and allow it to slowly fill up on its own. You still doing okay, Jerry?
Yeah, I'm doing good.
All right, so as I begin to pull this out, I want you to take a nice deep breath in and out. If you start to experience any sort of pain, please let me know. And we can stop, reassess. There's a chance that not all of the fluid came out. So I just want you to be very vocal with me. Let me know if you experience any sort of pain, okay?
Okay.
All right. I'm gonna detach this. And for now, I'm just going to leave it right here in case I need to pull more out. All right, we're gonna begin discontinuing. Are you ready?
Yep.
Deep breath in and out. All right, I'm feeling a little bit of resistance. So I'm gonna go ahead and just pull a little bit more out to be safe. You never know. You can never be too sure. All right, another deep breath in for me. And perfect. All right, so I am checking the tube for intactness. I can see that it is fully intact. There are no missing parts. There are no signs of blood, mucus, or any bleeding or any infection that I can see. So I'm gonna go ahead, we'll detach it from the bed and discard it in our hazard bag per facility policy. I'm just gonna take a look at your penis again. There are no signs of skin breakdown around the opening of your penis. Are you feeling any pain, tenderness, or anything like that?
No, I feel good.
Good, I'm glad to hear it. Are you doing okay? Was that pretty good for you?
Yeah, it didn't hurt at all.
Good, I'm glad. I'm just gonna discard of this into the hazard bag and we can throw this away as well. I'm gonna take my gloves off. We'll get some new gloves on. And we'll do your pericare, okay?
Okay, sounds good.
All right. Did you have any questions at all for me, Jerry?
No, I don't think so.
Perfect. Maybe.
So can I pee like normal now?
Yes, you should be able to. We do expect you to pee within the next 4 to 6 hours. If preferably 4 hours. If you have not peed by the 6-hour mark, you need to please let us know. That could be a risk for infection, or something could have gone wrong internally. So we just want to have to make sure on that. I'm just going to do my pericare as I'm talking to you. But pull back your foreskin and clean the foreskin. This goes into dirty linen. Once you are ready to pee or you feel the need to pee, since you don't have a catheter attached to you, you don't have to be so careful anymore, but we do ask, I'm gonna keep you dried up here, we do ask that you please use your call light and let us know, because we will want to measure the amount that you urinate. If you experience any pain while urinating, you see any blood in your urine, if your penis starts to swell at all, please just let us know, because that could be an issue too, and we want to make sure that everything is good internally, okay?
Okay.
All right, so I'm gonna go ahead, cover you back up. All right, we can put your bed down now. Do you want to stay lying down, or would you like to sit up a little more?
I think I'm comfortable right here.
Okay, wonderful. Did you have any other questions for me, Jerry?
I don't think so.
All right, do my hand hygiene here. I'm gonna put your bed down. All right, since these bubbles have gone down, I'm going to remeasure, make sure that we actually have the 200 cc that I saw prior, and I will discard of this per facility policy in the client's bathroom. Grab all my supplies, and then I'm gonna grab my biohazard bag. Okay, make sure your bed is still locked. I see you have your call light here, lowest position. All right, your belongings are right here. Is this close enough for you, Jerry?
Yep, that's great.
Okay, I'm gonna remove your privacy. Do my hand hygiene once more. Anything else I can do for you?
Nope.
All right, you have a wonderful day.
Thank you.
Thank you.